tube that I would put down her throat. And then watch the bottom of it. As soon as I get it down there, I would push this in. You see how this cuff blew up like a little balloon? So that locks it in place in her throat. Okay, and it goes right above where both of your lungs are, where your right and left lung are. And then I would hook this up to this machine right here. Okay? And then this machine would be breathing for her. Okay? So that way she can be asleep and we're breathing for her. But before we're going to do this, what we would do is we would have her count down, Aspen. So I'm going to have you count from 5 down to 1, okay, in order to get you prepared for the surgery, because the medicine's starting to hit you a little bit and you're going to be falling asleep soon, okay? So will you count from 5 down to 0 for me out loud?
No, start backwards.
Start at 5 and go 5, 3. Ooh, perfect. She's out.
Or if she wants to stay awake, guys, we could do what they call a spinal tap and put something in her back, a needle in her back, and it pretty much paralyzes that area so she won't feel it. But
All right. So if everybody wants to stand up, you can come around the bed. Don't get too close. Make sure you do not touch the blue. That is sterile, okay? Now, from where she's at right now, I would have a problem reaching. So what I'm going to do is I'm just going to raise the bed up. I'm going to bring her up to my level, okay?
And during a timeout, we do a timeout. We make sure we got the right patient at the right time, and we're going to do the right procedure.
Yep. So we've got the stomach marked here. What I'm going to do is I'm going to have Charmin come in. She's going to clean the stomach real good, okay? And now, once that has happened, it's go time. So now what we're going to do is we're going to make a little incision. But before we do this, what's the one thing that we always have to have in the operating room before a doctor can start a procedure? Anybody? There's one thing missing. See how quiet it is? Guess what doctors don't like? Quiet. They're going to have music in the operating room. Okay? Always have music. That's important. If you're ever a nurse, make sure you have music for the doctor. Okay? So, what I would come in is I would come in for Aspen's tummy, and I would make a little incision across, just like a little half moon. Okay? And then once I have done that, take a little bit of water, I'm going to clean a little bit, okay? And then guess what I would be doing from here? I'd be coming in, what would I be pulling out?
Baby.
A baby. Oh my goodness. Now, what would I do once I've done that?
Pass it to the nurse.
I would pass it to the nurse, let the nurse go, and be prepping the baby. Now, what do I have to do? Can I just leave an opening in Aspen's stomach?
No.
No, I can't, okay? I've got to stitch her, exactly. So here I would have my sewing needles right here, and I would come in, okay, and I'd have a needle attached to a long string, and I would be sewing her up. Once I'd done that, I would cut off the needle, and I've got to make sure that I have this needle accounted for. So I would then come in, and we have a box, and you'll see the numbers on the box. So I would put this is my first needle, so I would put it in box number 1 to keep accounted for it. Because what's the one thing I don't want to do? I don't want to leave anything in Aspen's stomach. I want to make sure everything that I use is accounted for. Okay? Now, once I have done that, and I've sewed her up, I've got to make sure that I can drop her back down. I can get her relaxed, because we're going to get her to where she is waking up. Okay? We're going to get her to where she's having some oxygen. And now, from here, we would be transferring her, and we're going to go over to the x-ray and make sure that everything on her inside, we'll take a picture of her and make sure everything's good. So do y'all know where the x-ray is? Okay. What I'm going to ask y'all to do then is to go out that door. We're going to hang a right and go out to the x-ray, and that'll be your next stop in the hospital visit, okay? All right. Good job, Aspen. We appreciate it. Thank you for doing so good. That was good stuff right there. All right? All right. No, that was